So welcome to our Thriving Kids webinar. I'm Dr. Jennifer Bombush from the UBC School of Nursing. You're invited to sign up for regular updates with our research cluster if you'd like, and the link for that will be put into the chat. And that way you'll know when we're doing our next webinar in the fall. And a reminder to everyone that this webinar is being recorded. I'd like to acknowledge that the UBC Vancouver Point Grey campus is located on the traditional ancestral unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. The UBC Vancouver Point Grey, the UBC Okanagan campus is situated on the traditional ancestral unceded territories of the Syilx Okanagan Nation. If you are joining from other territories, please acknowledge the traditional owners and caretakers of those lands. You can do this as appropriate to your specific location and add it to the chat. You can learn more about the Indigenous land that you are on by visiting this online resource, native-land.ca. A bit of housekeeping for our webinar, just during the presentations, if you have any questions or comments, please put them into the Q&A. At the end of the presentations, Dr. Lisa Olson, our cluster events co-chair, will facilitate the Q&A. Today's webinar is focused on climate change and climate impacts on children with medical complexity and their families. We have three wonderful speakers today, and I'm just going to read brief bios for each of them before we get into the panel. Vanessa Fong is a CIHR and Michael Smith Health Research BC funded postdoctoral fellow working with me at the School of Nursing. Her research focuses on health equity and improving health and social services for families of children with medical complexity from underserved communities. Sandra Kahle resides in Kelowna on the traditional ancestral and unceded territories of the Syilx Okanagan peoples with her husband Roy and their 4-year-old daughter Emily, who has additional support needs. They were evacuated from their home twice in 2023 due to forest fires that were within 1 kilometer of their residence. Sandra is now a full-time caregiver and advocate for medically complex children and their families. Prior to becoming a parent, Sandra was a dispute resolution and law firm administrator, mediator, and human resources executive, primarily based in Vancouver. And we also have Ben Mortenson, who is head of the Department of Occupational Science and Occupational Therapy at the University of British Columbia. Dr. Mortenson's research focuses on topics related to caregiving, assistive technology, and environmental sustainability. He is especially interested in improving accessibility and social participation for people with disabilities. I'm going to hand it off to our panel now, and each is going to speak for a bit, and then we'll have the Q&A. And I would just ask for our panel members to hand off to the next speaker when you're done. And so I believe we're starting with Vanessa.
Good. All right. So thank you, Jennifer, for the introduction. I'm really grateful to be here today to share some of our research findings from our study, which looked at the experiences of these climate-related weather events on families of children with medical complexity here in BC in the summer and fall of 2021. And the research that I'll be talking about today was part of a larger longitudinal study which looked at access to healthcare services for this population. So here's our agenda for today, and I'll just jump right in because we don't have a lot of time. So to begin with some background, this is not new information. Our planet is currently experiencing a climate crisis, and it's crucial to understand the global implications of this phenomenon. And the effects of climate change are also not isolated or distant, but are manifesting in tangible ways across the globe. And this graph here on the right shows the annual global mean temperature above pre-industrial levels. And you can see here that there have been year-to-year fluctuations, but the overall trend is a steady increase in global temperatures, creating the perfect storm for the extreme events that we saw again in 2021. So fast forward to last year, 2024 was the hottest year on record with global temperatures reaching 1.55 degrees Celsius above pre-industrial levels. And this threshold here that's indicated by the red dotted line is significant because it brings us dangerously close to that 1.5 degrees Celsius that was outlined in the Paris Agreement, where beyond this point, the risks of severe and irreversible climate impacts increase substantially. So while global temperatures are rising, what's even more concerning is that Canada is warming at nearly twice the global average. And the Canadian Arctic is warming almost 4 times as fast, putting northern communities and ecosystems at especially high risk. So this graph here on the right, there's a lot going on, but it's basically showing that global greenhouse gas concentrations, so specifically carbon dioxide and methane, are rising steadily. And these gases trap heat in the atmosphere and are the primary force behind global warming and the increasing frequency of extreme weather events that we're now seeing. So climate scientists have stated that what we saw in 2021, the heat wave, would have been virtually impossible without human-caused climate change. Oops, sorry. So I'll just go back because I wanted to say that a glimmer of hope in all of this really lies in the fact that this is human-caused, as we see from this graph. So it is within our control to do something to mitigate these effects. This diagram here is to illustrate that climate change is not just an environmental issue, it's a growing public health crisis. So events like extreme heat, wildfires, and flooding, they worsen air quality, they limit access to care, and increase the spread of disease for everyone. However, people with disabilities and chronic health conditions, seen here in the center of this diagram, are even more vulnerable for a number of reasons. For example, they may rely on life-sustaining equipment and medications. They may have limited mobility, making evacuation difficult. They may also face disruptions in access to specialized care that they require. And they also may be more susceptible to disease due to compromised immune systems and underlying health conditions. So I think this quote here really captures the reality of the climate crisis for many vulnerable communities, including the families that we spoke to in our study, and really underscores the importance of centering equity as we work towards solutions. So now that we've seen how climate is changing globally, I'll now talk a little bit about how these changes affected the province during the summer and fall of 2021. So in this slide, you can see a rough timeline of events that span through June to November. But it's important to note that these events took place over a span of about 5 months, leading to continuous and also overlapping disruption, all in the midst of COVID, if you remember. So it's not surprising that these events created major challenges for families and also placed additional strain on an already fragile system of care. So before diving into some of the impacts of the heat dome, it's important to clarify what a heat dome is, since it's not an official meteorological term. So essentially, a heat dome happens when there's a high pressure system which acts like a lid on a pot, trapping hot air underneath, creating an intense dome of heat over a region. And this can last from days to weeks. And as we saw here in BC during this heat dome, 60 temperature records were broken on June 27th. The temperature in Lytton, BC, reached a record-breaking 49.6 degrees Celsius, which is the highest ever recorded in the entire country. And during this heat dome, there are 55 heat warnings issued and approximately 619 deaths that occurred. So I think we know what wildfires are, so I'll just jump right into some quick numbers. So this was the 4th most destructive wildfire season in BC's history. And it's really important for the population that we're talking about today to note that there were 137 smoke-related air quality warnings in BC due to these wildfires. And a total of 56 days that were declared a provincial state of emergency for wildfire response. and approximately 32,000 people were displaced during this time. So you can see in this image on the right here, it just shows the massive scale of the Sparks Lake fire that occurred on June 30th. And you can imagine just from looking at this picture, the degree of destruction caused to the surrounding areas. Now, moving on to the floods that took place on November 17th, an atmospheric river caused record rainfall in southwestern BC, leading to a province-wide state of emergency. And this was largely due to warmer temperatures, which worsened flooding by speeding up snowmelt and also creating serious health risks in impacted areas. And the damage of this flooding was substantial. So over 5,000 people were impacted by evacuation orders in the Fraser Valley, and over 7,000 in Merritt because there was a wastewater plant failure caused by rising water. And additionally, 24 highways were closed during this time, which, as we heard from families that we spoke to, disrupted things like deliveries of medical supplies and created challenges accessing hospitals. So now that we've talked about what these climate-related weather events are, I'll now shift to describing who our population is and who we're talking about today. So historically, this group of children and youth with medical complexity has been difficult to define since there are various terms used in the literature. However, there's growing consensus around a set of shared characteristics, and these include having complex chronic conditions, functional limitations, significant caregiving needs, and frequent healthcare use. To illustrate this last point, although children with medical complexity represent less than 1% of the pediatric population, they account for roughly 57% of total pediatric healthcare costs and approximately 1 in 6 visits to the emergency department and about a third of hospital stays. So these statistics really just underscore why children with medical complexity are such an important population to understand and also support within our healthcare system. So now I'm going to move on to the current study and talk a little bit about the purpose as well as our methods now. So the purpose of this study was to explore the lived experience of families during the extreme weather events in BC and the strategies that they used to cope during these events. In terms of our data collection, we collected data using semi-structured interviews that were about 60 minutes long, and they were conducted between July 2021 and November 2022. Some information about our sample. So there were 30 participants in total, with the majority being mothers. Close to a third worked full-time, and almost half of the participants had a bachelor's degree. The majority were white, and most lived in an urban community. And some information about their children with medical complexity that they reported on. So about half were boys, with the average age being 10 years old, and the majority were enrolled in the at-home program, and about a third had nursing support services. So this map here is to show where our participants were approximately located. So you can see the different colors indicate the different health authorities, and the numbers on top represent how many participants were in each health authority. And you can see based on this map that the majority were located in the Fraser Health region here in the orange color. Oops. Sorry. Okay, so overlaid on top of this health authority map are the various locations in red here where wildfires took place across BC. And you can see the majority are located in the interior health region, where 2 of our participants are located, and some wildfires also in the northern health region, where again 2 participants are located. And overlaid on top of this health authority map again is showing where flooding took place in BC. And you can see that the majority of floods are in the interior health and the Fraser health regions like Abbotsford. So now I'm going to talk about what some of our main findings were. So this quote here highlights the added stress and vulnerability of children with medical complexity during extreme heat events. So for children who struggle with regulating their temperature, their body temperature, like this mother's son here, a heat dome is not just uncomfortable, it's a serious health risk. And public health restrictions related to COVID-19 during this time also made it harder for families to seek refuge in public spaces like malls, further limiting their options for staying cool. The second quote here illustrates how families are often forced to improvise in the face of limited resources. So the inability to even find something as basic as a fan shows the scarcity of cooling options, cooling solutions during heat waves. And a high demand of these cooling equipment during the heat dome also drove up prices, making it financially inaccessible for many families that are already under strain. In terms of the impacts of the flooding, this event also caused significant stress for families, with some unable to leave their communities due to washed out roads. Some parents were also very concerned about accessing emergency medical care if needed, and especially for children with medical complexity who can become critically ill very quickly, the inability to reach a hospital created a lot of fear and anxiety for caregivers. In this second quote here, a parent talks about how flooding damaged certain areas of their home where they stored their medical supplies, like formula and tube feeds were stored there, just putting their essential equipment at risk. And families were especially worried about replacing damaged supplies, since programs like the At Home program here in BC delivers medical items only once per month, and road closures delayed or disrupted these deliveries. In terms of the wildfires, while there were no families that had to evacuate during this, several were affected by the resulting poor air quality. So, for example, this quote here illustrates how these extreme weather events can confine families to their homes for an extended period of time as they're forced to create a controlled environment to protect their kids. Similarly, the second quote, a parent describes how their family stayed indoors for extended periods to protect their child, which was not uncommon for other families of children, specifically with respiratory issues or tracheostomies. So these families relied heavily on air conditioning and closed environments to help manage the air quality, just really underscoring the importance of safe indoor spaces during wildfire events. An issue cutting across all of these different weather events was the experience of social isolation for families, particularly for their children with medical complexity. So participants often described how these weather events was the reason for keeping their child home from school or daycare, and also highlighted how these disruptions took a toll on their mental health and reinforced these feelings of isolation, especially for children who already face barriers to social inclusion. So in some cases, the extreme heat caused critical medical equipment like wheelchairs to overheat or stop working, posing safety risks for children. And these equipment failures not only created physical safety risks, but also had emotional impacts. So some parents spoke about feeling increasingly anxious and worried about being trapped or unable to evacuate in an emergency. And in the literature, this is known as eco-anxiety, and it's becoming more common in children and youth to experience mental health impacts related to this awareness of all of these environmental threats. So now I'll just go over some key takeaways from the study. So families of children with medical complexity often have minimal formal supports, and as a result, they have to rely heavily on their own resources and their own informal peer networks during climate-related weather events, which is insufficient for them. We also saw that extreme weather events increased anxiety and stress for families. It also limited opportunities for social interaction and worsened feelings of isolation for caregivers and their children. And lastly, our findings also show that there are significant disparities within this population in both their ability to cope as well as their access to supports and resources. So now I'll talk about some solutions and recommendations based on our findings. So the first recommendation is to develop inclusive climate change policies that provide accessible hotel rooms, emergency generators or backup batteries, as well as funding for essential medical equipment. Because people with disabilities are statistically more likely to live in poverty due to higher living costs and things like that, these supports are critical to addressing the intersecting barriers they face during climate emergencies. The second recommendation is to ensure that health and social care programs include contingencies and supports for common climate-related weather events in their jurisdictions. Planning should also include formalized communication plans as well as assistance in creating care plans for these weather events. The third recommendation is to ensure that education and childcare options include access to virtual or online learning with supports from EAs. Schools should also prepare packages of at-home activities that are tailored to a child's specific needs. And based on what we heard from parents in our study, they need support in facilitating these social interactions with the child's peers, whether it's through online learning or virtual social activities to help reduce isolation during these events. And in closing, I just want to emphasize that our findings, alongside other important work from fellow researchers and activists, really underscore this urgent need to move beyond siloed approaches. Climate change is accelerating at an alarming pace, with global temperatures rising by approximately 0.2 degrees Celsius per decade, which is a rate that's much faster than in previous decades. So it's very clear that time is limited, and meaningful change requires not just shifts in our behaviors and values, but also a deeply collaborative and interdisciplinary response. So thank you all for being here today and listening. And thank you to our funders, CIHR, and our co-authors, and most importantly, the participants who generously shared their time and experiences during this immensely difficult period in our history. So now I'll just pass it on to Ben.
Okay. So I'm just going to talk really briefly a little bit about sort of occupational therapist perspectives on extreme weather events. So I've done a few studies talking with occupational therapists about how they're dealing with climate change in their practice. And so this is just a little bit of sort of reflections on those interviews, and then some of my own musings as well. But one a little bit of a caveat is that most of the occupational therapists I talk to, their practice is primarily with adults, so that some of this stuff may not be as transferable. So I will try and do some translating as I go. Yeah, so one of the, sorry, I got everyone's pictures in front of my notes. There we go. Yeah, so one of the points that it's already been raised is that they're talking about that people living, everyone is experiencing climate change. But obviously some people have better resources to deal with it. And so that was that boat metaphor that we heard earlier about the super yachts versus the dinghies without a paddle. And I would say that, therapists are not in the super yachts, but they're not in the dinghies either. So there's definitely a continuum. And so, yes, they have, they're going through a lot of these heat events, heat domes, probably less so of and poor air quality for sure, but less so maybe with the floods and evacuations, which affect obviously smaller numbers of people. That said, they also do have a lot of eco-anxiety as well. So it's, I think this isn't, it's not just among people with disability that, or who are having, or parents of children with disability that are having the eco-anxiety. And so they, one of the things that they recommend through the BCCDC is they have a document about extreme heat preparedness, and they really recommend that people in extreme heat who have disability seek cool places, so places with air conditioning. And that's obviously a great idea, but it's not always easy because there might be transportation problems getting there, especially if there's air quality issues. Some of the cooling centers may have accessibility issues. There's sometimes lack of information about their locations, also concerns about their safety and hygiene, and then limited hours. So obviously a great idea, but not always one that's accessible for people. BC Hydro does have a program to provide free air conditioners to people. But it used to be better, and they've really restricted the admission criteria for that. So basically, people have to be on the home care program or mental health and support services. So, or substance abuse program and then have a letter from the program. And so, as far as I'm aware, that people under there's children in the at-home program are not included in this. And then you also need landlord consent. And so there's a lot of people who actually get excluded from this access to this program. And I must be honest, I'm not a big fan of air conditioners as a rule, just in that, they are limited. They can generally only cool one room, which is better than nothing. But they also have impacts on the environment because of the energy consumption and the use of the refrigerants that go into their manufacturing. And as Jennifer, in her research, she pointed out that sometimes these units are sold out during extreme heat events, so they may not be accessible. Another option, which is probably better, would be the installation of a heat pump, because they cool in the summer and the heat in the winter, and they're really efficient in terms of energy use. And so they do have programs to facilitate, to basically rebate programs for people with lower incomes to help pay for heat pumps and sometimes pay for the entire cost in some cases. But once again, we got issues. There's obviously with the eligibility requirements, some people who are excluded that probably could really benefit. Even the application process is pretty hard. And then sometimes the contractors may not be in compliance. And so you might go through this whole process and discover your contractor wasn't in compliance. And then the government isn't willing to pay for the heat pump that's been installed. Sorry, trying to move to the next slide. This way. No. What's going on? Sorry, I've lost the ability to move slides. Why is that? That's weird. No. Oh, I'll try this. There we go. So the other, just obviously we've been talking a lot about heat, but there's other things that people encounter. So we have extreme weather events like snowfall. And if anyone's dealt with snowfall and used a wheelchair before, you know that can sometimes make it impossible to leave your home because roadwalks and sidewalks become impassable. A few years ago, we had people trapped in the George Massey Tunnel for 8 hours overnight because of a snowfall event. And then we have this weird thing in Quebec. The snow removal is actually the responsibility of the city. So the city clears the sidewalks and they become accessible. Whereas in BC and Vancouver specifically, it's the responsibility of the homeowner. And so if you get people who are away during a snowfall event or renting or whatnot, you'll end up with a lot of sidewalks not being shoveled. And just as a totally ironic turn of events, a few years ago, the city of Vancouver fined people in June for failing to remove the snow in January, which of course is completely useless. But that's how sometimes city governments work. Yeah. Anyway, and then the other issues is things around flooding and fires, which we've already heard a little bit about, just in terms of accessibility of transportation during evacuation, accessibility of temporary accommodations, accessing electricity in case of prolonged power failure. So the BC government has a couple of support programs, the emergency support services and disaster financial assistance, which, obviously those are great ideas and to help people with disabilities. But they're not, once again, we have these problems with accessibility. So they're sometimes difficult to access in terms of even just the process of applying. And then there's issues with things like the accessibility of local reception centers, communication, and and these have all been identified by people like the BC Ombudsman. And I have links in my slideshow that I can share with people. So just in concluding, I just want to emphasize that I think one of the big concerns I have is that a lot of the messaging is about self-sufficiency and all the emergency prepared just documents. The idea is you need to be able to, basically be completely self-sufficient for, 3 days or 2 days, whatever it is. But it doesn't really recognize what me and a lot of my participants talk about as a disability tax. And that, yeah, if you're living with a disability or have children with disability, you are much more likely to experience poverty. And then you add on that the fact that if you need a wheelchair accessible van, it's 2 or 3 times the cost of a regular personal car. And so there's these huge financial barriers for people to be able to be self-sufficient for even short periods of time. And I just don't feel like a lot of the programs really are recognizing this at this point. So this speaks to the need for a lot of policy changes, but also highlights some of the challenges that occupational therapists experience, because they're trying to help people, but they're also really constrained by the system with which they work. Okay, and I will stop there and turn things over to Sandra.
Thank you so much. So my name is Sandra Kahle. I live in Kelowna, BC, and we live about 10 minutes from town, just up the hill. We overlook Lake Okanagan. We back onto Knox Mountain Park. In 2023, we were evacuated twice. The first time was on July 1st, Canada Day. There was a smoker hiking up in Knox Mountain, and with their cigarette, some ash lit the park on fire. So we were downtown enjoying the Canada Day celebrations. We actually happened to be with our neighbors, there's 2 Ukrainian refugees that we helped come over to Canada. They were living across the street from us at the time with a family, 7 people in the house, but they had a 5-seater vehicle plus a cat. So we were with them, thankfully, so we were able to coordinate much easier to help them evacuate also. But because we were prepared, we were able to not only get everything we needed, but to get what they needed. And also our elderly neighbor who was out of town at the time, he had just lost his wife and was out of province visiting family, but we have keys to each other's houses. So I was able to contact him and say, hey, what is it that you need? Like, I've got some time to go get your important things too. So it worked out very well. And August 17th, 2023, some pictures. So our daughter has Down syndrome, and my husband and I were out at our first and only parent and caregiver night out in Kelowna downtown, actually in Rutland, but with the families, with the parents anyways, and caregivers. And our daughter was almost 3 at the time. Usually when she is a support worker with her, they're usually at our house. And if that was the case, we would have been alerted much sooner. But this time they were actually downtown and they were at her place. And this is the fire that was started over in West Kelowna. It seemed very far away. We felt like it was safe enough to go out for the evening. When we were leaving the event, I took my phone out and my husband was driving. And so we needed my messages. I had a message from my mom, one from my sister. They live in Lake Country in Vernon. And they were like, hey, are you guys okay with the fires? I'm like, I said to Roy, I said, they know where we live, right? I mean, this is odd. Kind of joked about it, texted back, yeah, we're fine. The fire's in West Kelowna. We didn't know the fire had jumped the lake. So the photo on the left that you're looking at there is, these are all photos that my neighbors have taken. That is in Knox Mountain Park. And this is West Kelowna, you see across the way, that's West Side Road. And so people are looking at the fire. It hadn't jumped the lake yet. It did jump the lake. The second picture there is that same hill. The house you're looking at is 2 doors down from mine. And that third photo you see, this now the fire is up on Wilden. So this is now jumped the lake. This is on our side of the lake at the end of our street and up the hill. And the lamp that you see on the left, that's actually my house. That's where we live. So it was extremely close. And on the August 17th fire, we were not here. So we got our daughter. We still didn't know about the fire. We picked her up, we're driving home, and my neighbor calls, the one that we'd helped out, the elderly gentleman, and says, I noticed you guys aren't home. Just so you know, the fires jumped the lake. That's when we learned. And I says, but can I grab some stuff for you? And I said, well, we're about 5 minutes away, so thank you, but we'll be right there. Our dog and cat were there, and our grab and go boxes, everything was there. We didn't have anything with us. And there was a police blockade at the bottom of the road. They weren't letting anybody up. My husband parked the car, went over and chatted with them. He had to go back 3 times before they finally said, yes, okay, we'll let you up the hill. There was no order at this point. It was just an alert, but it was very fluid and it was very uncertain what was happening. So there was a lot of confusion. So we were allowed up the hill, but we should have always been allowed up the hill because there was no order to evacuate at that point, at least certainly not in our area where we were. So it was a little frustrating, but we did eventually get up the hill. And so then how to prepare. So we use an app. We used to use Microsoft To Do. We now use one called Todoist, and it's an electronic app. We both have access to this on our phones. So we can see in real time when something is added, something is removed, and we have our entire packing list, which will be shared with you later, and you can modify it for your own use to make sure we know that something has been grabbed, something hasn't been grabbed. When there's an emergency, like it's just like it's all hands on deck. You got to do what you got to do, and you don't want somebody wasting time. Like, did they grab the cat or not? Like it's on the list, it's marked off. Yes, we've got the cat. The cat's in the carrier. The carrier's in the car. And also assigning certain family members to look after certain things. So in case of emergency, it's me who gets the kid and the animals and gets them all safely in their carriers and car seating in the car. And I'm grabbing the medical supplies, certain things. My husband grabs the grab and go boxes. He's got he goes and gets the documentation. That's all pre-organized. And it works very, very well. We've unfortunately had a few times we've had to do this. And now prior to the fire and flood season as well, it's important to review and update the items on your list. Pre-pack your grab and go boxes. So any essentials, anything extra that you have, especially with medically complex kids, make sure you have what you need. You've got your feed pump, extra supplies, like you've got the extra like feeding bags, some extra food, if it's the stuff in pouches and that sort of thing, your syringes for your medication. Yeah, so then also inventory your home contents. It helps to make a video. There's tons of information about that online in general. Making sure your tank is full of gas because you might not be able to get some. And another important thing too is that if your power goes out, your garage door won't open. So electronically, so you're going to have to do this manually. Practice that ahead of time so you don't like load your car and then you're stuck in your garage and don't know how to actually get out. There's a way to do it manually. Make sure you know how to do that. General notes, have a backup plan for if you run out of essential supplies. If your child or somebody, yourself, whomever is needing to have certain things, like especially if it's life-sustaining, like you need extra oxygen tanks, you need your tube feeding, you need your medications. Make sure you have a way to get that. What happened during the fires is we have local groups of medically complex families, and so we were able to say, go on there and say, hey, I need some extra this, I need some extra that. Does anybody have some just to spare? Like, because we weren't all evacuated, of course, right? So that's helpful to be able to have that. And also joining some local fire and flood watch social media groups. There are some that I'm aware of locally that are up on the UBC Thriving Kids website, I believe. And also be cognizant of who in your neighborhood might not know that there's an emergency. Like my neighbors are mostly 70 and 80 years old. I kind of joke the average age in our subdivision is, sorry, volume, I don't know how to do that. Like, it's my computer popping up. I don't think it's actually a message. Sorry, that's a thing I'm on 2 different devices, and the one device is saying they can't hear me. Never mind. And it was making sure that they're aware that there is a fire, because some of them don't have access to social media, and they might not even know that there's an emergency that they need to prepare for. And also creating a list of who to inform and how to reach them, and email that to yourself ahead of time so that you can update them later once you have evacuated to let them know that you're safe, and also coordinate any extra supplies that you need. So my packing list, what I do is we have 3 different levels of importance. So we have level 1, like the star items. These are the items that you absolutely must have on you before you leave the house. That's like your kid, put their name on there too. If you've got a bunch of kids, you want to make sure like child 1, 2, 3, 4, they're all in the car, they're secured, and your animals as well. The animals should be in carriers with labeled, have your leashes and collars and whatnot to make sure they can't just run off if the carrier opens, because they will get skittish. So then there's level 2 as well. So other medical equipment, sorry, level 1 again, life-sustaining equipment. That's meant to be on there. Not sure why it's not, sorry. It is on the main list. Level 2, any other equipment for us that, for example, would be a CPAP machine. Level 1 would be like a feeding equipment, oxygen, your trach equipment. Level 3, this is like if you still have actual time to go back and go back after, if you don't have enough time to pack everything at the time, the next day you go back and get this extra stuff. As you're about to leave, check in on those neighbors. Maybe you offered a ride to somebody, make sure you do that. And then once you have evacuated, head to your evacuation center and inform all your people. So that's what I've got, and I'll turn it over now to Lise for Q&A.
Great. Thank you to our 3 presenters for those interesting and informative presentations. We have time for some questions. So if you do have a question, if you could please post it in the Q&A section, and then we can share it and find out who would like to take the question on. So I just have a couple here just to start us off a little bit. One kind of goes back to the beginning, and Vanessa or somebody else might want to just share what are some examples of medical complexities for children, like physical or mental or both, or if you could just give a little overview of what that consists of.
I can try to take this on, but Jennifer and Lise, you might need to also confirm this. I'm not a clinician. So this can include the co-occurrence of multiple health conditions, and these can include things like mental, physical, and medical conditions. So an example might be a child might have a rare genetic disorder and also experience developmental delays, or mental health challenges like anxiety or depression as a result. I think, Jennifer, do you want to?
Sure. I'll just add, so the description of medical complexity is more based on function and use of healthcare services than specific diagnoses. I think that a lot of kids who have ultra rare and rare diseases fit within this category. And so when we do our research with this population, we're less focused on actual diagnostic labels and more focused on some of those characteristics of functional dependence and use of healthcare services to describe this population.
That's helpful. Thanks so much, Jennifer. I think that gives us a good overview. Vanessa, this is a next question also from Jad, just specifically around your study and your study methods. If you could tell us a bit about the qualitative data analysis specific approach that you used, whether it was thematic or content analysis, or how did you undertake that phase of your research?
For sure. So we used an inductive approach to descriptive content analysis, and this helped us identify different themes and patterns based on the participants that we were talking to, without kind of imposing any preconceived kind of categories. Yeah. Jennifer, do you want to add anything else to that?
Just briefly, one of the things that is really nice about this type of qualitative research is that it's very flexible. So this research was done as part of an ongoing longitudinal case study project that wasn't originally focused on climate impacts. But what happened, it was actually originally focused on the impacts of the COVID-19 pandemic on families, but it was during the data collection that all of these climate events were happening. So we added the question about those impacts into the interview guide, and we're able to sort of do a just-in-time research project, which I think was really neat and really reflects that flexibility of qualitative research to be able to do that. And so it was really not just the climate events, but also the ongoing public health measures that were impacting these families during that time. And I did earlier post the link to the open access article, so anybody who'd like to read more about the study can download it from the publisher. Thanks.
I'll just jump to one more. Thanks for that, Jennifer. I'll just jump to one more methodological question since we were on that track, Vanessa. Joseph asks about, thanks for the wonderful presentation, and is wondering about the sampling technique that was employed, and how did you manage or determine your sample size for the study?
Yeah, I'll try to answer this. So we first drew from like a survey study that Jennifer did during the pandemic. So it was a cross-sectional survey. And I think it was around August that this survey was done. And then based on that survey, participants that completed the survey, they were able to indicate if they wanted to participate in more in-depth interviews. And then based on that, I think Jennifer, you looked at like socio-demographics of those participants to try to find underrepresented groups to participate in these interviews. And then I guess also in terms of sampling, like recruitment posters were shared widely through Facebook, and is that not right, Jennifer?
No, I'm fooling around and accidentally deleted Tasha's question. So Tasha, if you could retype it, that would be great. I apologize.
It's still there under answered.
Oh, thank
It just
goodness.
hasn't been answered. It just
Okay, too
still
much
there. Yeah.
technology for.
So sorry, yeah. So based on that's kind of how we found this group to interview. And then I think the question's asking about like data saturation, kind of. Is that how did we know when we were done? Is that the main question?
I think just your sampling technique in general. Yeah. So.
And it's described in detail in the article, so you can also get the information there.
And it's open access. So you are
Perfect. Thanks for that. So now we move on to a couple of questions that are more around knowledge translation and kind of moving these findings into practice and policy. So Tash is asking, thanking you for the excellent presentations and wondering if you've had opportunity to engage with policy decision makers, translating these insights into emergency preparedness standards or legislation, and if you've had a chance to share that, what the reception has been like. Or perhaps this is too early a stage to talk about that, but if you have some ideas on what those next stages might look like, that would be really helpful.
Sure, I can answer that a bit, and Ben might want to jump in too. I think that I'm happy to see some familiar names on this webinar. So this is part of what our work of our cluster is, to help share this information. In the fall, we'll be having a hackathon on climate impacts for these families, and I'll post some information in the chat about that. And hopefully, if you'd like to attend and be part of it, that would be great. I think that our province is uniquely interested in looking at supporting all citizens and people with disabilities during climate-related weather events, which continue to happen. We're having heat event warnings, we're having wildfire warnings every day already, and it's mid-June. So I think that work is ongoing. And if there are any policy and decision makers out there that want to connect with us, we're always happy to present to meetings and different groups. And Ben, I don't know if you want to add to that, maybe.
Sure. Yeah. So we have a little bit of money from CIHR. And right now we're looking at creating some resources for people from marginalized groups to deal with climate change issues. So it'll be emergencies, but also just climate change more generally. So you'll, I guess, keep looking in this space because we're just getting our ethics approved right now. But then we'll be recruiting people. And most of the time, we're going to be basically looking at existing resources and getting people to just review them and maybe add some extra stuff. But it'll probably, I'm hoping it's not going to be like the need to create anything from scratch at this point, because I think there's lots of stuff out there, but we want to just bring it all together and probably put some tweaks on it. So, and it's hopefully that's the kind of stuff that we can not just share with people with lived experience, but then also give to the policymakers to say, here's the gaps, right? Because, yeah, people can do all these, amazing contortions to deal with climate change emergencies, but, at some point, policy needs to change so that they don't have to.
Thanks for that, Ben. There's a question here from Patricia that's a little more specific about how do we work collectively to advocate to the at-home program for better emergency equipment coverage. So there may be a couple of people with thoughts on that.
Sandra, I don't know if you have any ideas around the advocacy with the at-home program piece.
I do. Let me just check our participant list. Just see if the person I have in mind is here at the moment. She was earlier. It's not coming up. If that person is here, you would know who you are. If you want to speak up, please do. Oh, there we go. Yeah, I think you might maybe be here still. I just know there are some people that do advocate, but let's see. Or maybe not. Okay. Yeah, there are some in the group of complex families. There certainly are a number of individuals in that group who do regularly meet with government officials and make recommendations, and they're quite active in advocacy. So I do expect that this is something that is being raised and has been raised. Yeah.
Great, thanks, Sandra. We are at 1 o'clock, but we have one more question, so maybe we can just squeeze it in, and if people need to leave, then that's fine. A question from Ingrid, I think, is kind of a big picture question, and thinking about these supports to families where there's so many service providers are interacting, for example, schools, health, and so when we're talking about discussion to prepare for emergencies in the home, things can slip through the cracks potentially. So what makes the most sense in terms of leadership and assessing families and developing these emergency supports and helping some of these separate groups and sectors work more effectively together?
I think that in all of our work with this population, it's interministerial in British Columbia, and I think across Canada and federally. So within BC, we need to be focused on targeting those conversations that bring together people from different ministries. And as Sandra mentioned, leadership from BC Complex Families Society and Brenda Lenehan, who's often at those tables, is really important. And I think also, the grassroots piece of it, because a lot of climate activism and work is done at the grassroots level. And so people like Sandra, I've done a lot of work in this area. I have lists, and Sandra has added to that list today. So we've created a spot on our Thriving Kids website to collect this information, and people are welcome to fill in the form so you can add to our list. And then it's really around public sharing of that and making sure through social media and different aspects of communication that we're letting people know. And I'm just going to return to something before we close off that Ben mentioned around how this is very much treated as, you need to do this on your own. And we all collectively need to shift that thinking. This isn't something people should be left on their own to do. We need government supports. I think that they're happening. I think they're growing, and just consistently contributing to the conversation, I think, is really helpful. So maybe on that note, I'll thank everybody who was on the panel today. Such an interesting conversation. Lots more work to be done. And our webinar series will be back in the fall. And Lisa, I don't know if you recalled some of the topics that we were planning to do when we pick it up again in September.
I think we had a couple of ideas, but it was in the working the working stage of confirming those presentations. I think Ben, you were going to focus on one more topic.
We've done a study working with Accessibility Standards Canada to look at improving accessibility of preschool spaces. So that's definitely, I think, one of the topics we'll be presenting on, not just me, but others in that space as well. So I think that'll be a great one.
And we may have one as well in regards to safe access to emergency department, the experience of caregivers and their children around ED experiences in rural EDs. So that's another topic that may come up in the fall. So stay tuned to our program for the fall, and thanks so much everybody for attending today. And the hackathon, that sounds really exciting, Jennifer.
Yeah, well, we'll see how that goes. I don't quite know yet. So thanks everybody. And if you're not on our list to find out about the upcoming webinars, please join the list so you get that news. And we'll wish you all a good summer, hopefully free from too many climate emergencies. Stay cool, stay safe, and we'll see you all again in the fall. Thank you.